Hi, my name is Marin, and in partial fulfillment for N5309, Teaching, Learning Theories, Strategies, and Evaluation with Dr. Wendy Barr, I'll be presenting the use of algorithms as a teaching and learning strategy. Let's go ahead and set the scene. It was a dark and stormy night, and Candace, a new nurse in Hospital XYZ, was working her first shift in the emergency department. It was high acuity patient load, the census was high, and the department was short-staffed. Let's go ahead and fast forward to Candace's first interaction with her patient.
Hi, I'm Candace. I'm your nurse while you're at the hospital. Can you tell me what's wrong?
Where am I? Who are you?
Can you tell me what hurts?
My stomach. I can't pee. I have diarrhea. I think it's my appendix.
It looks like you might have a fever, and you're breathing fast. Your heart rate is also fast. You might have an infection.
Candace suspects infection. Something tells me she's starting to get concerned about this patient.
You might be septic. I wish I had an algorithm.
I thought you'd never ask!
I wanted to remember what to do. This is awesome.
That's right, it sure is awesome. This is a sepsis algorithm that we use here at Hospital XYZ. Algorithms are commonly put together as a collaborative effort with physicians, nurses, and pharmacists for patient care topics such as sepsis or stroke, or even restraints. So let's go ahead and take a look at this algorithm. It provides Candace with a step-by-step procedure and how to take care of her patient, in case she forgets. She already mentioned that she thinks the patient has a suspected infection. Where does she go from here? It provides her an easy tool to refer back to and guide her, in this case, SIRS criteria. She's looking to see if the patient demonstrates any one of the SIRS criteria so she can move along in the algorithm. Let's go ahead and see what she has to say.
Well, he has a temperature, and his heart rate is 100. His respiratory rate is 26.
Sounds like he meets at least 2 or 3 of the SIRS criteria. This can help Candace guide her way through the algorithm. He meets criteria. He has a suspected infection. It guides her to the next key clinical indicators for this patient, such as obtaining blood cultures, obtaining the lactic acid, and assessing for signs of organ dysfunction. I feel like I remember the patient saying that he had decreased urine output. He seemed to be confused. So maybe he does meet these criteria. I think Candace could probably move along in the algorithm. Yes. In case Candace could remember what labs she should draw, this provides it right here for her. A lactate, assessing the patient's MAP, and whether or not he has greater than 1 organ dysfunction. What are the lab results, Candace?
The lactate's 6.3, and he has low urine output, so he is septic.
So these are yes, so this moves her here, or no moves her here. So he does meet these following, so she can go right here to severe sepsis or septic shock. What do you think you should do next?
Well, if I go by the algorithm, I should probably give him an antibiotic and transfer him to the ICU and place a central line.
It's a good thing Candace is prepared thanks to the algorithm. She's got the central line right here. Okay. Pause it. It's a good thing that Candace was able to identify all those key indicators that she needs to do, including the central line. Without the algorithm, she might not have known that she needed to use the central line. And now that she's got that central line, she can do other pertinent care issues such as normal saline, 30 milliliters per kilogram bolus, or monitoring central venous pressure with goals of 8 to 12. If CVP less than 8, then do this. Or monitoring the patient's MAP, 65 to 90. If the MAP less than 65, place arterial line, and initiate vasopressors. Candace can also monitor the SCDO2 with a goal of greater than 70, and if less than 70, more indicators whether or not she should transfuse or initiate dobutamine, depending on the hemoglobin levels. This will help Candace meet the early interventions and 6-hour goals as she continues for the care of the patient, and the continuum of the care when she transfers the patient to the ICU. Algorithms are excellent teaching or learning strategies and can be used in situations such as this simulation, discussion with peers, or in case studies, and in reviewing any sort of key cases that came through an emergency department or an ICU. Now that we've gone through this sepsis algorithm, I think there's only one thing that we can say. Stopping sepsis